Doctors, what's your he shouldn't have survived story? Story 1. Her peritoneum was exposed. Skin and tissue gone. Necrotizing fasciitis had eaten her abdomen, flanks, thighs, under her breasts, even the top of her lady parts. I measured the wound myself, 7 centimeter deep in places, 120 centimeter long. She was just a regular woman, bit overweight, some hypertension, but smart, hardworking, an aviation mechanic. All of it started from a bug bite or a small cut after swimming in a local lake. She came in with only a 10% chance of survival. I'm a wound care nurse, been doing this for 6 years, and I honestly didn't think she'd make it. But after months of treatment, skin grafts, physical and occupational therapy, she walked out of our facility. Walked. Scarred, yes, but alive and well. That's one I'll never forget. Story 2. When we peeled her off the motel chair, her flesh stayed behind. She'd sat there for 45 days, urinating, defecating, not moving, not showering. She and her mother both had severe mental illness. Motel staff called due to the smell. By the time she got to me, she'd had several surgeries. Her wound was 20 to 25 centimeters deep. I could fit half my forearm inside. Both buttocks were gone, just a hollowed out space down to bone, sacrum exposed, vertebrae visible. She had a colostomy and a urostomy. I've been in wound care a long time, but watching her body rebuild itself, regrow 2 separate cheeks, it stunned me. She and her mom became 2 of my favorite patients. Strange thing to say, maybe, but it's true. Story 3. I had a skydiving accident where neither my main parachute nor my reserve opened correctly. The reserve chute barely deployed halfway. I hit the ground hard, shattered femur, open book pelvis, burst spinal fracture, broken ribs. I won't ever skydive again, but I'm lucky. I'm alive. My wife is a flight nurse, and her coworker was on the helicopter that picked me up. They saved my life. I'll walk again too. I owe everything to that crew. Story 4. He looked like a purple potato with toothpicks for limbs and inflated hands. Mr. X, 38, came in with a swollen abdomen, extreme fatigue, and massive lymph nodes. Biopsy said Hodgkin's lymphoma, aggressive subtype. I'm a hematologist, and I knew the odds weren't good. After just half a round of chemo, he asked to be discharged so he could die at home. But on the way home, he got hungry, really hungry. Devoured a dozen cans of Spam. His friend joked, "If you can eat that, you can survive more chemo." 1 month later, he returned, healthy, groomed, ready to continue treatment. I didn't even recognize him. After 8 rounds, he had a complete response. 5 years later, he's still doing great. I still tell that story. Spam saved a life that day. Story 5. He had a hemoglobin level of 2.7. That's all I need to say, really. He should have been dead. I was the lab tech who drew his blood. It looked thin, watery. The machine didn't even register it at first. Normal hemoglobin is 12 to 16. Below 8 is critical. 2.7? You don't walk in talking at 2.7. But he did. Turns out it was due to years of heavy drinking and poor nutrition, alcoholic anemia. His body had adjusted slowly, which is the only reason he didn't drop dead. We transfused a few units and sent him to another facility. He survived, although his organs are pretty damaged. Still, the fact that he was conscious at all. I'll never forget that. Story 6. My dad got hit by a train while riding his bike. The train was going 80 miles per hour. I'll never forget that call. At the hospital, they told us he probably wouldn't make it. His blood pressure was tanking. They cut a hole in his stomach, and somehow that stabilized him for the night. Weeks later, he woke up, multiple broken ribs, both collarbones, a traumatic brain injury, collapsed lungs, right arm destroyed. Doctors said he'd never work again. But my dad? He's stubborn as hell. By August, just a few months later, he went back to work as a VP. December, he bought a new bike. Today, he's totally normal. I owe so much to the people who saved him. Story 7. He had a knife sticking halfway out of his sternum. Foot-long scalp laceration, several abdominal punctures, and still talking to EMTs. I was the trauma resident on call. We rushed him to the OR, but not for surgery. He was stable enough that we did conscious sedation and just pulled the knife out while surgeons stood by, ready to jump in. No organ damage. Nothing vital hit. I still don't understand how that's possible. He was discharged that night. His brother had done it. Police took him into custody, and I sent the patient home. I still shake my head thinking about that one. Story 8. He was just a torso. No legs, no waist, nothing below mid-abdomen. I was a nurse on the floor, and I only saw him in passing. He was a gunshot victim, I think, but whatever happened, it was bad enough that surgeons amputated everything below the abdomen. He had surgical drains and tubes to manage bodily functions. No pelvis, no legs. Just arms, chest, neck, and head. I walked past his room and saw him, alive, conscious. It was like something out of The Walking Dead. I didn't care for him directly, but I'll never forget that image. That he survived it all is wild. Story 9. I was a phlebotomist during COVID. In one weekend, I watched 6 patients die in our ICU. One man stuck with me. I drew his blood every morning. His wife, not allowed in the unit, waited for updates. I'd try to give her small reassurances. His blood pressure looked okay today, or his blood was easier to draw. I'd talk to him while he was unconscious, tell him how much she missed him. He coded at least twice. Everyone thought he'd be next. Then I came back after a weekend off, and his room was empty. I panicked, until someone told me he was moved to the first floor. I rushed to his new room. He was sitting up in bed, smiling. I cried in front of him. He walked out of that hospital. I still don't know how. Story 10. My wife was 34 weeks pregnant when she mentioned the baby hadn't been moving much. It was probably nothing, but she brought it up during a routine checkup. Thank God she did. The doctor did an ultrasound and found a placental abruption. They had to do an emergency C-section immediately. If she hadn't said anything, both she and the baby might have died within hours. That small detail saved their lives. Today, both are happy and healthy. Please tell your doctors everything, even the things you think are unimportant. Story 11. I walked into the doctor's office for a routine checkup. Within an hour, I learned I had almost no red blood cells. The doctor kept asking me how I was even standing. Apparently, I had lived with severe anemia for 5 years, unknowingly. I wasn't just anemic, I was dangerously close to dying. The doctor was stunned I hadn't collapsed on the floor. The weirdest part? The year before, my dog had a similar situation. We took her to the vet because she was bleeding everywhere, and her white blood cell count turned out to be literally 0. Neither of us should be alive, honestly. But here we are, both still kicking. I'm grateful every day. I don't know how we made it, but I'm damn sure glad we did. Story 12. I was 300 pounds and a heavy drinker. One night, I blacked out after a dinner out with friends. The last thing I remember was taking one last bite. I woke up nearly 24 hours later in a hospital bed, hooked up to multiple machines. My wife was crying beside me. I couldn't speak. The attending doctor came in and read my chart out loud. BAC was 0.28, blood pressure 150 over 110, blood sugar 115. He looked straight at me and said, "You should be dead. If you don't change now, you will be." That was my wake-up call. After I got out, I lost the weight. I'm down to 185 pounds now. I quit drinking for good, cleaned up my life, and got serious about my health. I know I'm lucky. I shouldn't have walked out of that hospital. But I did, and I'm not wasting the second chance I was given. Story 13. I was volunteering at the hospital when EMS brought in a code. No pulse, no blood pressure, no heartbeat. Basically, dead on arrival. They tried everything, bagging, drugs, chest compressions. Nothing worked. The doctor called time. I had just lost a young cancer patient I'd been sitting with, and I went down to the morgue to pay my respects. I was crying when I heard banging, coming from the freezer. My first thought, zombie movie. But I opened it. The guy inside was alive, breathing. I hit the panic button, and within seconds, doctors and nurses were rushing in. Turns out he had 2 rare conditions. One that slowed his heart so much it was undetectable, and another that caused false negatives on EKGs. So while everything looked like death, he wasn't dead at all. I'll never forget that moment. The dead guy banging to get out. Still gives me chills. Story 14. Winter 1986. I was a second-year medical student in Oklahoma City. A 68-year-old man coded on the med-surg floor, cardiac arrest. Code blue. About 20 of us were there, including interns and med students. We tried everything, every drug in the crash cart. 45 minutes in, someone said we should stop. But I decided to try a pericardiocentesis, drawing fluid from around the heart. I got about 25 ccs of clear fluid out. Another resident said, that wasn't enough to do anything. But within seconds, we had a measurable blood pressure. We rushed him to the ICU. Over a year later, I was treating a woman at a different hospital, and her father came to visit. We chatted, and he said, I was real sick last year at the VA. Those doctors saved my life. It was him. I hadn't recognized him, but he looked amazing. I'm glad we didn't give up. Sometimes a little hope, and a long shot, can save a life. Story 15. 10 years ago today, I woke up from a coma. I had suffered an anoxic brain injury. No brain activity. The neurologist told my wife, "This is the definition of brain death." They said I'd eventually die of infection. My entire care team agreed. But my wife, she wasn't having it. She moved me to a long-term acute care hospital. There, they started physical therapy, just moving me around like a puppet. Somehow, I started to respond. Slowly, I improved. I don't remember any of it, but I know this: I'm alive. I'm talking. I'm walking. I got better. The coma lasted a month, but my wife never gave up. She saved my life by refusing to listen to the experts. I owe her everything. Story 16. I fell off a 3-story house while working as an electrician. No harness. I crashed face first onto a concrete pad. Broke every bone in my face, plus both wrists and a forearm. I didn't even make it to the hospital right away. When I did, the nurses called me the boy who lived. One of the Harry Potter movies had just come out, and I guess the nickname stuck. I don't really remember the fall. Just waking up in the orthopedic ward a few days later, my wife by my side, terrified but holding it together. The doctors said I shouldn't have survived. But I did. I owe that to the people who put me back together, surgeons, nurses, and probably a bit of luck too. Story 17. I'm an EMTB. My partner and I got called to a man in his 40s with chest pain and shortness of breath. He was sitting at the kitchen table, tripod position, visibly struggling. We got him on oxygen, hooked up the monitor, and radioed the hospital. Though due to radio failure, they didn't know what was coming. No paramedic backup was available, so we rushed him in. As we transferred him to the hospital bed, he went into full cardiac arrest. CPR began immediately. The doctors found he'd had a pulmonary embolism, a STEMI, and a stroke simultaneously. Somehow they brought him back. I don't know if he survived long term, but I know we got him alive to the hospital. That was a hell of a shift. Story 18. My wife walks 7 miles a day and is in great shape. But just before Christmas, she complained of stomach cramps. She figured it was the flu. I noticed her belly was oddly swollen, looked 5 months pregnant, which was impossible because she'd had a hysterectomy. We went to the ER, but it was packed. 14 hours later, they finally did an X-ray. Her colon had ruptured. She was septic. Emergency surgery removed her ascending colon and gave her an ileostomy. She coded multiple times in recovery. ICU nurses called her the Christmas miracle. Sepsis had shut down nearly everything. Later, her surgeon admitted that no one else had ever survived a complete septic shutdown on his table. She's still here, 17 years later. She's the toughest woman I know. Story 19. In 2020, I was part of a clinical trial and had blood drawn every 2 weeks. Everything seemed fine, except I noticed bruising more than usual. I didn't think much of it. Then the lab called. My blood had 0 clotting factors. They told me if I saw any more bruises in the next 24 hours, I needed to go to the ER immediately. They canceled all my blood work for a month. Somehow, when I went back for the next draw, everything was normal, except for some mild anemia. To this day, no one knows why it happened. Just one of those medical mysteries, I guess. But I'm glad they caught it. Story 20. The doorbell rang. A stranger said, "I'm with the ambulance. Your husband's in the back." He'd forgotten his phone, so they took a detour to notify me. I jumped in. My husband had been hit by a car going 40 miles per hour. He was strapped to a gurney, bleeding, road burn everywhere, face, arms, legs, stomach. They rushed him to the hospital for scans. MRI of the head? Clear. Abdomen? No internal bleeding. Full body X-ray? Not a single broken bone. The doctor looked at him and said, "I don't understand how you're not more injured." The only explanation was that he went limp, like a rag doll, which somehow saved him. He healed completely. If you'd seen him, you'd have sworn he wouldn't walk again. But he did. Story 21. I got shot 13 times. All flesh wounds. I was at a family reunion. When I got to the hospital, I looked the nurse straight in the eye and said, "I'm never going to another family reunion again." She blinked and asked, "Wait, you were shot at a family reunion?" I nodded. "Yeah, and the same thing happened last year. Different shooter, same event. Hospitalized both times. I'm not sure how this keeps happening or why I keep going back, but I guess I've got a sense of humor about it now. Honestly, If you get shot at every family reunion, maybe it's time to rethink family ties. I've seen less chaos in reality TV. Story 22. He wasn't breathing. We got to the shady motel after PD called us in. I'm a fireman and my officer, and I started chest compressions immediately. The ambulance had no idea it was a cardiac arrest. They were expecting vomiting, thanks to a statewide radio failure. We worked him for 45 minutes. No pulse. He was bleeding severely from a lower GI bleed. We loaded him into the ambulance, and the medic decided to check one more time with a 12 lead. Shockable rhythm. Screw it, the medic said. They shocked him. A weak pulse returned, then stronger, then breathing. Narcan brought him back even more. I don't know if he made it long term, but we got him to the hospital alive. That's something. Story 23. His oxygen saturation was 64%. He had walked 2 kilometers to the hospital. I was a first-year resident during the first COVID wave when I met this 63-year-old man. He looked surprisingly alert, but his O2 reading was terrifying. Most people with a saturation that low are either dead or already on a ventilator. I suspected COVID right away, and a massive heart attack. He tested positive. We intubated him, placed him on a ventilator, and inserted 2 new coronary stents within an hour. If he had waited even another hour or 2, he likely would have arrested from arrhythmia. He spent 2 months recovering, but he made it. I still think about how close he came to dying after that walk. Story 24. I saw his brain. Literally. The helmet had dug into his skull during the motorcycle crash. He had a massive fracture and a traumatic brain injury. I was the OR nurse when he came in for a CT scan. The anesthetist pulled back the gauze, and there it was, his brain clearly visible. The irony? The helmet caused the damage, but without it, he would have lost his head. So yeah, it saved his life and caused the injury. He was intubated by the Rhesus team and stabilized. It was one of the most surreal moments of my nursing career, seeing someone alive with their brain exposed. Story 25. I went into cardiac arrest and nearly died. I'd gone to the ER with what felt like flu symptoms, chills, fatigue, lightheadedness. Within an hour, I was in full cardiac arrest. My organs were shutting down, my oxygen was crashing, and I was on the verge of death from something I'd never even heard of, Addison's disease. My potassium was sky high, I was severely hypoglycemic, and they were preparing to fly me to another hospital for life support. Before the flight, they gave me a large dose of hydrocortisone, and that's what saved me. I stabilized almost immediately. That's how they figured out I had Addison's. My body can't produce cortisol, and in a crisis, that can be fatal. Now my case is used to teach med students about rare diagnoses. I'm still processing everything, but I know I was close to not making it. Thanks to one correct decision at the right time, I'm still here, and I'll be on medication for life, but alive. Story 26. I walked into the ER with what turned out to be an internal decapitation. My head wasn't attached to my spine. Earlier that day, I had been in a car crash. Paramedics checked me at the scene and sent me home. A few hours later, I developed a bad headache and decided to go to the hospital. I walked in, alert and talking. The ER staff were shocked when they saw the imaging. My skull had completely dislocated from my spine. They couldn't believe I was alive, much less standing and speaking. Internal decapitation is almost always fatal. I was rushed to emergency surgery immediately. I don't remember much about that day, but I know it was a miracle I survived. Everyone told me how rare it was. The doctors said they'd never seen a case like mine where the patient walked in on their own. I still have some lingering effects, but I'm here. I'm healing. I shouldn't have lived, but somehow I did. Story 27. I was just 23 and figured the swelling in my jaw was a dental issue. I couldn't open my mouth and was in serious pain, so I went to the ER. They gave me antibiotics and pain meds, told me it was an infection. I left, but the swelling got worse, my face ballooned, and my throat started to feel tight. I went back. This time, they ran scans and found 3 abscesses deep in my face. My airway was at risk. Because I couldn't open my mouth, they had to intubate me differently and perform emergency surgery to drain the infections. I woke up with 3 surgical drains in my face. The surgeon told me that if I had waited another day, I likely wouldn't have survived. I never expected something like that from a tooth infection. It was terrifying. I'm okay now, but I have a new respect for pain signals and a much lower threshold for seeking care. That close call changed everything for me. Story 28. I was pinned under a collapsed building beam after a car accident. I'd crashed into a structure, and the front of my car was crushed. A beam came down and landed right across my lap. Everything below my waist was trapped. I remember the fire crew arriving and trying to keep me calm while they worked to free me. I was alert, but I knew something was very wrong. My left leg was crushed. They suspected I had crush syndrome, where toxins build up in trapped muscles and flood your system once the pressure is released. I lost my leg, but I survived. The doctors said I shouldn't have made it. The damage was extensive, and the risk of cardiac arrest was high once they lifted the beam. But they acted fast, and I lived. Recovery's been tough, and life is different now, but I'm still here. I've learned to walk again with a prosthetic, and every day I'm grateful that rescue team didn't give up on me. Story 29. I ignored a small wound on my foot. I'm diabetic, and I thought it would heal on its own. I didn't want to go to the doctor. I should have. The wound got worse, then infected. Eventually, I collapsed and was rushed to the hospital. I was in a coma for 3 months. By the time I woke up, I had lost one leg at the hip and the heel of the other foot. My remaining leg had a massive wound, 15 centimeters long and nearly to the bone. My lower back and thighs were completely gone. I lost part of my intestine and had to get a stoma. I was also obese, which made treatment harder. At one point, I used the hole in my abdomen as a cup holder. I even underwent maggot therapy, and we reused the maggots by making them puke so they'd eat more infected tissue. I suffered brain damage and kept trying to walk even though I couldn't. But I survived. I'm still here. It was a nightmare, but somehow I made it through. Story 30. I'm an eye doctor in New York City, and 20 years ago, I examined a patient I'll never forget. He was a retired cop and sat down wearing a hat. When he took it off, I saw a crater in his skull. He told me he'd been shot years ago. The bullet hit his chest, ricocheted up through his cheek, passed through his left eye, entered his brain, and exited through his skull. I was stunned. I performed an eye exam, and somehow, despite the path of the bullet, he had 20/20 vision. The retina had a perfect, narrow trail where the bullet passed, but no permanent damage. Cognitively, he was fully functional, sharp, articulate, even humorous. I had to double-check his file to believe it. A bullet had traveled through his face and brain, and he was completely fine. It was like something out of a medical journal. I still tell med students about him. He remains one of the most medically baffling and inspiring patients I've ever seen. Story 31. I was bartending when someone burst in yelling that a man had collapsed in the beer garden. I ran outside and found him unconscious, not breathing, choking on vomit. His pulse was weak, pupils blown. I rolled him onto his side and opened his mouth. Blood and vomit poured out. Then he stopped breathing. I started CPR. I'd never done it outside of training. It felt like forever. When the ambulance arrived, I was shaking and covered in vomit. I honestly thought he was gone. A month later, he walked into the bar. I didn't recognize him at first. He asked for me. "Someone here saved my life," he said. It was him. He'd overdosed on heroin and coke and died twice in the hospital. He'd been on a ventilator for a week. He brought me flowers. I cried right there behind the bar. I never expected to see him again. That night changed me. I don't know if I saved his life, but I helped him survive until help came. That's enough. Story 32. My great-uncle was a tough man. He worked hard labor jobs his whole life and had constant back pain. Eventually, he was put on a morphine pump. In the 2010s, he was hospitalized twice with pneumonia. Both times, we thought we'd lose him. But he fought through it. He was the kind of man who just kept going, no matter what. We used to joke that he was held together by modern medicine and sheer willpower. He finally passed away in February at the age of 82. I miss him a lot. But when I think back on all the times he cheated death, surviving illness after illness, managing pain, and still making it to every family event, I'm just grateful for the extra years we got. He lived a full life, and I think he knew it. He wasn't afraid to go when it was time. I still hear his voice in my head sometimes, reminding me to keep pushing forward. He lived longer than anyone expected, and he lived well. Story 33. I was in a car accident while high. I'd taken a mix of drugs, heroin, meth, benzos, and went driving. I don't remember the crash. They told me later that I hit a pole and my head went through the windshield. I had multiple organ injuries, a skull fracture, and I was bleeding internally. They didn't think I'd survive. I was in a coma for a while. When I woke up, I was in the ICU, tubes everywhere. My dog had been with me during the crash, and I asked about him constantly. They told me he was okay. He'd been picked up by animal services and was waiting for me. That was what kept me going. I got out, went through rehab, and made it home. The first thing I did was hug my dog. I'm still recovering, but I'm clean now. That crash nearly killed me, and it saved me too. I don't want to go back to who I was before. Story 34. They call it the Widowmaker, a full blockage of the left main coronary artery. That's what I had. I came into the ER with chest pain and shortness of breath. I didn't think it was anything serious, but the doctor looked at my EKG and moved fast. I was rushed into the cath lab. They found a complete blockage. Most people don't survive that kind of heart attack. I was lucky I came in when I did. They put in a stent and stabilized me. The cardiologist told me afterward that if I'd waited even 15 more minutes, I likely would have died. I had no idea I was that close to death. Now I'm on medication and watching my health closely. I've made lifestyle changes too. Every time I hear the word Widowmaker, I think that could have been me. I got a second chance, and I don't plan to waste it. Story 35. I had a heart attack while driving. I don't remember much from that day. I was behind the wheel, then everything went black. Apparently, I crashed into a pole. Bystanders pulled me from the car and started CPR. Paramedics arrived quickly and kept working on me. I was clinically dead for several minutes. I woke up in the hospital, confused, sore, and wired to monitors. The doctors told me I'd had a massive heart attack and had been resuscitated at the scene. I'd needed emergency surgery and stents placed. I couldn't believe it. I'd always considered myself healthy. No big warning signs. But that crash, and those strangers who didn't hesitate to help, saved my life. I spent weeks recovering, went through cardiac rehab, and eventually walked out of the hospital on my own. I know how close I came to dying. Every breath I take now feels like something I earned. I'll never forget the people who brought me back. Story 36. I was walking home when a Jeep hit me. I flew 14 feet through the air and landed hard. I remember the impact, then pain everywhere. I was rushed to the hospital with serious injuries, broken bones, deep lacerations, nerve damage. My pelvis was fractured, and I had internal bleeding. I spent days in the ICU and weeks recovering. The doctors couldn't believe I didn't die on the spot. They said the way I landed spared my spine, and probably my life. I still have nerve issues in my legs, and walking isn't the same anymore. But I'm alive. I go to physical therapy, and I'm regaining strength little by little. It's strange to think that if I'd taken one step differently, things might have ended that night. I'm more cautious now, more grateful. I don't take crossing the street for granted anymore. That accident changed my life, but it didn't end it, and for that, I'm thankful. Story 37. I was crushed by a tractor. I'd been working on the farm when it rolled off a small slope and trapped me underneath. My bones were shattered. My spine, both legs and arm, everything broken. I lay there, screaming, until help arrived. I was airlifted to the hospital and underwent dozens of surgeries. They replaced almost every major bone in my body with titanium rods and plates. People started calling me the Tin Man. I didn't mind. I was just happy to be alive. The recovery was brutal, months in bed, years of rehab. But I walked again. I got back on my feet, literally. Around town, people still recognize me and ask how I survived. I tell them it was a mix of luck, stubbornness, and a hell of a trauma team. I should have died that day under that tractor. Instead, I became a bit of a local legend. And I never take a single step for granted now. Story 38. I was working intake at the jail when they brought him in. He seemed fine, quiet, a little out of it. Then he collapsed. I called for help, and the medics came running. He was overdosing and fading fast. They gave him Narcan, nothing. Another dose, still nothing. Finally, after the third dose, he started to come back. It turned out he had smuggled morphine pills inside his body, rectally. The casing had broken, and the drugs entered his system all at once. It nearly killed him. He was rushed to the hospital, and they told us later he was lucky to be alive. I'd seen overdoses before, but never one like that. It was a reminder of how fragile life is, and how fast things can go from normal to emergency. He survived, but I still think about how close he came. All because of a few pills he thought he could hide. I hope he realized how lucky he was. Story 39. I ignored chest pain for a week. I was gaming, distracted, and didn't want to deal with it. The pressure in my chest got worse, but I brushed it off as stress or maybe heartburn. Eventually, it got so bad I could barely breathe. I walked to the hospital. They ran tests and told me I had a collapsed lung, a spontaneous pneumothorax. The doctors were shocked I'd made it there on foot. They said most people with my vitals would have called an ambulance or passed out. I spent a few days in the hospital with a chest tube, recovering. The pain was awful, but the scariest part was how close I came to dying without realizing it. I'm healthier now, and more in tune with my body. I've learned not to ignore serious symptoms, no matter how inconvenient they seem. I was lucky, but I know better now. Story 40. I live in a long-term care facility, and when COVID hit, it spread like wildfire. Almost everyone got it, residents, staff, even the kitchen workers. But somehow I didn't. I tested negative every time. I had no symptoms, just slightly blue feet, which the nurse said was probably unrelated. I stayed in my room, wore a mask, and followed every protocol. Still, it felt like pure luck. People I'd known for years died in just a few days. It was terrifying. The halls were quiet, and meals were left at our doors. Isolation was hard, but I made it. I don't know why I was spared. Maybe genetics, maybe the timing. But I'm still here. I still think about those who didn't make it. I wasn't the strongest or the healthiest, but somehow, I didn't get sick. I don't take that lightly. Story 41. I had to have my sternum removed. I developed a deep infection after surgery, and it just wouldn't heal. They tried everything, antibiotics, wound care, but the infection reached the bone. The surgeons told me the only option left was to remove my sternum entirely. I remember lying in bed afterward, just skin over my heart. No bone protecting my chest. Every cough, every sneeze, every breath, I had to brace myself. I wore a special vest and avoided crowds. I lived like that for months, waiting for a custom titanium implant. The doctors told me most people wouldn't have survived such an infection, let alone the recovery. It was terrifying, but I made it. I'm still healing, still waiting for the implant. But I'm alive. That's what matters. Story 42. I overdosed in a self-life attempt. I took several medications, Xanax, Ambien, Klonopin, and Ativan. I don't remember much. My heart stopped. I was rushed to the hospital, put on a ventilator, and stayed in a coma. My organs began to fail, liver, kidneys, everything shutting down. The doctors didn't think I'd make it, but I did. I woke up slowly, confused and foggy. I had nerve damage and memory loss. Some of it's permanent. I still struggle with words sometimes, but I'm here. I got help. Therapy, medication, support. I'm not the same as before, but I'm alive. And I'm trying. That one decision almost ended everything, but it didn't. I'm learning to live again, piece by piece. Story 43. I had a ruptured intestine and didn't know it. For 2 weeks, I worked through the pain, thinking it was constipation or maybe food poisoning. I went to urgent care, then the ER, twice. They sent me home both times. By the third visit, I could barely walk. A CT scan revealed the truth. My large intestine had ruptured. I had full-blown sepsis. Emergency surgery saved my life. The surgeon said it was a miracle I'd survived that long. Scar tissue had walled off the infection, fusing my intestine to other organs and keeping the sepsis from spreading further. My body had literally saved itself. I had a temporary colostomy and months of recovery ahead, but I was alive. Every doctor I saw afterward said the same thing. I don't know how you made it, but I did. Story 44. I was working L&D when the patient said something that stopped me cold. The baby hasn't moved much today. She wasn't frantic, just calm. But I knew something was wrong. I called the OB immediately. We hooked her up to monitors, fetal distress. An ultrasound showed a uterine abruption. We rushed her into emergency surgery. Within minutes, the baby was out, but blue, not breathing. NICU worked fast. Then, after what felt like forever, we heard a cry. The mom had lost a lot of blood, but she pulled through too. The next day, she thanked me for listening. That simple sentence, "The baby isn't moving," saved 2 lives. I'll never ignore my instincts again. Story 45. I was a trauma nurse working the night shift when the call came in. Motorcycle crash, high speed, helmetless rider. He arrived barely conscious, face torn open, breathing shallow. His left leg was twisted in a way that still haunts me. Blood soaked the stretcher. We rolled him into Trauma 1, and I remember thinking, this guy's going to code. He had a torn aorta. That's usually a death sentence outside of surgery, but somehow, his blood pressure held long enough to get him to the OR. His liver was lacerated, spleen in pieces, 1 lung collapsed. His skull had multiple fractures. We didn't even have time for full imaging, just enough to know he was bleeding out fast. The trauma surgeon said later that the only reason he survived was that the torn portion of his aorta had somehow sealed itself just enough to slow the bleed. It was like the body knew how to hold on. He spent 3 months in the ICU, then rehab. When I saw him walk back into the hospital a year later, with a cane and a smile, I nearly cried. He shouldn't have made it, but he did, and I'll never forget him. Story 46. I was the ICU nurse when he came in, handcuffed, barely breathing. He'd jumped off a bridge 12 stories. Suicide attempt. Paramedics said they found him on the riverbank with both legs broken, several ribs shattered, and internal bleeding. Normally, a fall from that height means instant death. But somehow, he hit the water at just the right angle, then bounced off a sandbar close to shore. That sandbar probably saved his life, and nearly ended it. He had a broken spine, punctured lung, and a ruptured spleen. We intubated him right away. The trauma team worked for hours. He coded once during surgery, but came back. Weeks passed. He went from ventilator to speech therapy, from complete paralysis to twitching toes. Months later, he walked with a walker out of the hospital. He looked me in the eye and said, "I didn't want to survive, but thanks for not giving up on me." He shouldn't have made it, but he did. And sometimes, that's enough to rewrite someone's story. Story 47. I was a brand new paramedic when we got the call. Infant, unresponsive, possible drowning. We pulled up to a backyard pool where a 2-year-old had fallen in. Family said she'd been under for at least 10 minutes. I remember her tiny body, blue lips, limp arms. I started compressions while my partner bagged her. I kept thinking, there's no way. But we weren't going to stop. She didn't respond in the ambulance. No pulse, no breathing. But cold water can sometimes preserve the brain. We got her to the ER, still doing compressions. They worked on her for almost an hour. Then suddenly she gasped. Just once, but it was enough. 3 days later, she opened her eyes. A week later, she smiled. No brain damage. No deficits. Full recovery. I still don't understand it. I've seen dozens of drownings since then, and none ended like that. She was the first and only one to come back like that. She shouldn't have survived. But she did, and I've believed in miracles ever since.